Hi, my name is Eric Marsh, and I am a pastor here in Long Beach. And with me are two remarkable medical professionals who have given of their time and are going to be here. First is Dr. David Gray, who is a pharmacist. We'll hear a little bit more about him in just a moment. And also with us is Dr. Kevin Ford. Dr. Ford, thank you for joining us. Michael Ford, we're really glad to have you here. We have people who are joining us, people coming on. We are live on Facebook, and we are looking forward to hearing a lot more about the questions that people have regarding the COVID vaccine, how the science works, how it's been helpful, how quickly it came out. So we're going to hear a little bit more. We're going to hear a presentation from Dr. Gray, and then we'll have a Q&A time with both doctors at the end. We'll be in and out in an hour. My name is Eric Marsh, and I am the director of the Long Beach Church Collective. I'm also an associate pastor at Park Church. My family and I live here in Long Beach, and we're really, really glad to be here with you. So we're going to dive right in. We're going to have with us in a few minutes, we're going to have Gregory Sanders, who leads the Ministers Alliance. He's actually talking about the vaccine with the health department right now, so he'll join us in about 15 minutes. Dr. Michael Ford is an anesthesiologist and has been practicing at Memorial for more than 23 years. He did his residency at Harvard UCLA and did his medical school at UCSD and is a member at Antioch, Long Beach, great church in central Long Beach that just got a new building. So Michael, Dr. Ford, thank you for being on with us. We're glad you didn't get called off to an emergency.
My pleasure.
With us as well, and we'll hear from him first, is Dr. David Gray. He graduated from the USC School of Pharmacy and spent the majority of his career, his entire career, working for the Department of Veteran Affairs. In short, he did a lot of his work with the local VA here. He'll talk about that in just a second, and was also promoted to the position of Pharmacist Executive for Southern California and Nevada, and was on the formulary committee for the National VA. So this came together because Dr. Gray did a presentation to his congregation, which is Grace Seal Beach, a couple weeks ago. It was very, very well received, and so we asked him if he'd be willing to share, and then have Dr. Ford on with us as well to answer questions. So, gentlemen, again, we're really glad you're here. Thank you. There's a lot of questions that people have. There's a lot of information coming around. So even before, let's do this. Before Dr. Gray jumps into his presentation, do either of you have any brief comments you'd like to make before we dive right in?
I would just like to say that it's very important that people realize the pandemic and really respect the dangers that it really poses to themselves and their family members. It's not a hoax, again, whatever, it's not a political issue or anything like that. I see it every day, all ages, and it's really saddening.
Wow.
Yeah. Thanks for the invite, Eric, and I'm looking forward to sharing with everyone. And I'm anticipating and hoping that the church leaders will be advocates, for their members in pursuing vaccination when it's available to them.
That's great. Well, why don't I'm just going to pray. We're followers of Jesus, so I'm going to pray, and then we'll let you dive right in, Dr. Gray. Jesus, thank you for this gathering, this opportunity to learn. Thank you for the way in which we have to be able to listen to professionals who are giving their time right now to let us know more about the opportunities to have the vaccine, particularly for our most vulnerable members of our congregations. We pray this in the name of Jesus. Amen. All right, Dr. Gray, I pass the conch to you.
Okay, so I'm going to go to share my screen and see if I can do that. Is my screen being shared now?
It is.
Okay, great. I just need to move us over to the side a little bit, I guess. There we go. Okay, thanks everyone, and thank you, Eric, for the opportunity to share. I know we've all been inundated. We can't stay away from the news about COVID and the vaccines and all that information, and it can get confusing and misleading at times. And so I'm hoping this will help clarify, a few questions that you may have. So the goal is really to share the information, again, on COVID risk, to highlight the risk and who's at risk for severe disease, to talk about the vaccines, talk about their safety, talk about how effective they are, and then how they're making decisions on who should get that vaccine first and how that's working. And then encourage all church leaders to consider being advocates for vaccination. So we got a picture here, of one of the vaccines and a kind of a schematic here of the COVID virus with the spike proteins that you've probably heard about. So what I first would like to share is that we probably don't hear it as much now as we heard several months ago, but we heard from a lot of sources, COVID, that's just a bad case of the flu. Well, I wanted to share this with you to put that in perspective. The influenza that we had in this past year affected about 38 million people and about 22,000 deaths. COVID-19, and these numbers are still a few days old, so they're not even up to date, has affected 25 million people, fewer people so far, but 420,000 deaths. So obviously, we can see some people have very little symptoms, but the ones who catch COVID and get severe disease, it's obviously a deadly illness. And to highlight that, out of everyone who tests positive for COVID, 1 out of 12 will be hospitalized. And out of those, 1 out of 12 may require care in an intensive care unit. And Dr. Ford, I'm sure, has seen many, many of those in his practice to date, and we'll share that during the Q&A. I wanted to highlight a little bit about who's at risk. And if we look at the graph we have on the left, that shows the percentages of patients by age who were infected with COVID. And you can see percentage of all patients that are affected with COVID, is higher in the 18 to the age of about 64 or so. But when we start looking at deaths by age, you can see that it's not who was infected the most, it's how it impacted those that are at the elderly end of the scale. So you can see that there's a reason why they're focusing on individuals over age 75 or over age 65, because with age, severe illness increases. And this kind of highlights, this is the mortality rates, and you can see the dramatic differences for folks who are over age 85, folks that are over age 75, and comparing those two in the different age ranges. Those mortality rates, which look at how much mortality there would be for 100,000 people getting COVID within that age category, that's what the mortality rate would be. So it's multiple fold as you get older. But it's not only age. There are other individuals, regardless of age, who are at risk for severe illness. And by being at risk for severe COVID illness, we're talking about requiring hospitalization, admission to the ICU, intubation, or death. And so the CDC continues to look at this, and they continue to revise this list. But we know individuals who have these conditions are at a higher risk regardless of age. And that includes individuals with cancer, chronic kidney disease, those with lung diseases like emphysema or chronic bronchitis, even some inherited diseases like Down syndrome, heart conditions, heart failure, coronary artery disease, obesity, pregnancy, sickle cell disease, smoking, and diabetes. So this is the current list, and they will continue to revise that as they learn more about that. So it's not just age. So what do we know about the vaccines? We've seen tons of information about the vaccines in the media, and we're going to talk primarily today about the two that are out there, which is the Pfizer vaccine and the Moderna vaccine. Both these are messenger RNA vaccines, and I'll kind of describe what is that. That sounds pretty confusing. It sounds like it affects my genes. And then we'll have, I just wanted to mention that there are two other vaccines that are on the horizon. And the one that from Johnson & Johnson is a vaccine that we'll hear data on next week. And if that data looks good, that could be available for use sometime in February, possibly, if the FDA approves it, if the data looks good. That's a one-shot vaccine, and they have a little different mechanism, more of a traditional mechanism of action for a vaccine. And then we've heard about the Oxford AstraZeneca one, and probably around April, we'll have enough information on that. So I'm going to primarily talk about what we have today, but we know that there are a couple vaccines that are on the horizon. And so what is this vaccine? How does the Pfizer vaccine and Moderna vaccine really work? What is a messenger RNA? Messenger RNA is really that component in cells that tells your DNA, hey, I want you to produce this protein to be used. And so this vaccine is the messenger RNA that it tells the body, it says, let's make a protein that looks like a spike on the COVID virus. So it creates a protein that kind of looks like COVID, the spike in the virus. And so the body is going to look at that and say, hey, this protein, it's foreign to me. I'm going to develop some antibodies to it, and I'm going to fight that virus and knock it out. So that's kind of how it works. And that messenger RNA that is injected into your deltoid gets into the cells, produces that messenger RNA is gone within about a day or two. Okay, so it's done its work within a couple of days to create these proteins which the body reacts to. Okay, and how effective are these vaccines? These vaccines from both Moderna and from Pfizer are about 95% effective. And that compares very favorably to vaccines that we know are effective. We know that the MMR vaccine we give to children is 95 to 100% effective. We know that the Shingrix vaccine to prevent shingles in senior adults is 97% effective. Those are very effective. But we also know there's a lot of other vaccines that are not quite as effective. Pneumococcal vaccine, about 45%. Influenza, which changes from year to year. We try to predict what flu strain is coming out. So the effectiveness of flu vaccine can kind of vary from year to year. So if we compare these vaccines to our most effective vaccines, they are very comparable to our most effective vaccines. And this is the information on how effective they are. We know that they were given in 2 doses, that the Moderna vaccine is given 1 dose and another dose 4 weeks later, and the Pfizer 1 dose and a dose 3 weeks later. And they studied thousands and thousands of patients. And they found that after that second dose of the vaccine, that it's about 95% effective. We know that it's effective in adults. We know that it's effective across, cultural lines. It's effective in everyone. We know that it's effective in the elderly, regardless of the age group. And we also know that even those who may get COVID, who got a vaccine, that 5% that may get COVID, they'll get a milder disease. That's what they know so far. And the one thing about the Pfizer vaccine, that's age 16 to 17 and above. And Moderna is for age 18 and above, because that's what it's been studied in. And so studies in children are ongoing, but they're first addressing, vaccinating the adult population, then they will go to the children, and they're doing those studies now. We also know the onset of effectiveness starts about 12 to 14 days after that first dose. There may be some effectiveness, but you don't really get the full effectiveness till after that second dose. So even though it starts working early on, you still need to use those precautions, because a full effect won't take place until after that second dose. Well, what about the side effects? We hear and we know lots of people that have gotten vaccinated so far. I've been vaccinated. I've talked to other individuals who have been vaccinated, and there's a range of side effects, but most side effects are mild. Most are, mild reactions, and we'll talk a little bit about that. And then some can be a little bit more moderate. And then on a very rare circumstance is a severe allergic reaction, but those are very, very rare. And there's ongoing monitoring. Now that we have over 16 million Americans that have received the vaccine, we have a real good track record of knowing what kind of side effects these vaccines may produce. So in the clinical trials, what did they find? Most people may get injection site reaction. They may get a sore arm for a little while. Some may get fatigue or headache. So those are not that uncommon. some people may get, for a day or two later, they may get more fatigue, more flu-like symptoms. Getting flu-like symptoms tells you that the vaccine is working. It's creating your body to fight, that virus, be ready to fight that virus when it comes. And we know the reaction is more frequent after the second dose. So you may have a little more side effects after the second dose than you have at the first dose. I guess for those of us who are getting older, the one good news is that the severity of the reactions are a little less after the first and second dose. So, that's, I guess, one of the few benefits of getting older. And then, of course, we know that there's rare allergic reactions. And these were approved through a process to make sure that something would be available to us in a public health emergency. So this is an emergency use authorization the FDA follows to make sure that these products could be available during a public health emergency. So they've undergone rigorous studies and to determine how effective they are and their safety. And now that we've vaccinated millions of Americans, we have a lot more information on them. There are a few things that we don't know. Okay, we get the vaccine. How long does it last? We don't know yet. Will it be 1 year? Will it be 2 years? Will it be 5 years? We don't. Before we need a booster shot, we don't know that yet. Not until it's been around for a while will we know how long it's going to protect us. We don't know yet. Will it prevent us from infecting somebody else? You figure you have the vaccine, you're not catching COVID. You may get exposed to the COVID virus, but you're not getting a COVID illness. Could you infect somebody else? They don't know that yet, and they're still studying that. So they recommend we still shoot, even though we've been vaccinated, we still follow precautions. We still wear the face mask. We still use the social distancing, and be careful around people especially that haven't been vaccinated. And again, we're studying. We haven't studied populations of children yet in pregnancy and lactation, and in people that have compromised immune systems. So there's a few things that we don't know yet about the vaccines. So who gets the vaccine? That's kind of like the million-dollar question. A lot of work science has gone into developing how do we prioritize? And they've looked at two main things. Can we prevent severe illness and death? And can we preserve social functioning? And so those are two of the areas that they focused in on as they develop these priorities. Who decides? The Center for Disease Control provided some recommendations, but those are recommendations. Then the state with their departments of health will develop their guidance and their requirements. And then there could be influences of special interests who say, oh, we should be that next group of people that get this vaccine. So there's a lot out there, and as if you've been watching the media, this priority has kind of changed over time. So this really looks at how they balance that. And this is the priority 1A. This is the first groups of individuals who got vaccinated, and they were the healthcare workers, and make sure we vaccinate the healthcare workers who are exposed to the vaccine, exposed to the virus while they're taking care of patients. We need to preserve that, develop and protect them. And then we need to treat the long-term care facility residents and the people that take care of them, because 40% of deaths are within that population. So those were where they went after initially and developing that initial priority. So how do they come up with, there were many, many individuals, ethicists, scientists who came up with priorities and how should we prioritize this vaccine, who should get it. And they looked at the science, and they looked at the implementation. Well, how would you implement it? And then they looked at the ethics. What would be ethical in distributing these vaccines, which are in short supply? So their principles that they followed these are called bioethical principles, is to maximize benefits, which we call beneficence, to minimize harms, which we call non-maleficence. And then we want to make sure we eliminate health inequities and treat all populations in all communities alike, and that's justice. So that was a key part of coming up with these ethical principles that they developed. They wanted to be transparent so everybody would know how that worked. And they wanted to allow for choice or autonomy or individual choice in receiving that vaccine. And this slide is what the initial recommendations were. And I'm just showing this slide because it's changed. This was in December. And if you look on the right-hand side, it tells you how many millions of individuals would fall within those categories. So the top category, which we talked about, 24 million people. The next one would be 49, and then 129 million people. We have about 260 million adults. So we're looking at how do we vaccinate 260 million adults, and how do we develop a priority for that? So they came up with this. Then Department of Health and Human Services made a decision that they announced that we're going to add, besides healthcare personnel and those who are in long-term care facilities, we want to reach people age 65 and older. That went out, and the states immediately, most all states immediately adopted that. So that increased the numbers of folks who would be eligible for vaccination dramatically. And of course, we have a limited supply, right? So that's going to impact the availability of the vaccine. So this is a California priority, and this is pretty much, and I'll show what Long Beach has as far as their prioritization, because I think that's very pertinent for our group here, is that phase 1A is the healthcare workers, long-term care residents, phase 1B, age 65 and older, and then certain frontline workers like educators, teachers, people that work at emergency services, and grocery store workers and others involved in food and agriculture. And then they prioritized other types of workers, other age groups, and other individuals with risk of these other categories. And I won't go into detail because these keep changing, and California will probably be shuffling this around a little bit. But I wanted to share what Long Beach is doing. And so right now, eligible in Long Beach, of course, we have the healthcare workers and long-term care facility residents. And Long Beach has said that they've really covered quite a few individuals in those categories. And now eligible now, and they're vaccinating those over 65, emergency service workers, educators, and those working in grocery stores and in food handling. So that's happening now actually in Long Beach. So they're a little far ahead in opening that up to other types of workers than, let's say, Los Angeles County or Orange County, who are sticking with 65 and older for right now. This is kind of what, as they were looking at the different priorities and figuring out, well, how much vaccine do we need to have available? And at what time would we get that vaccine so that we could vaccinate everybody who wanted one in those categories? So if we look nationally and we went through these first three priority groups, that would be about 202 million people. And that would leave about 60 million Americans that wouldn't fall into those categories, who would be the last to be offered the vaccine. If we have a 70% vaccination acceptance rate, everybody is not going to get vaccinated. It would be great if we had 70, great if we had 80%, the more, the better, they're vaccinated. And that tells us that probably out of these initial priorities, we'd probably be vaccinating 140 million Americans. So with that, and with the expected availability vaccine, if they follow this schedule, perhaps it would be available to the general public in May. We're behind that right now. And so we'll have to see if they can catch up, if there's increases in the vaccination rate, if the Johnson & Johnson vaccine gets approved, where we'd be able to get closer to that ability to be able to vaccinate everybody and have it available to everybody within a certain period of time. And that's been one of the challenges. One of the challenges is, and this slide here is again a few days old, it changes every day. 44 million vaccine doses have been distributed, but only 23 million were administered. So they're trying to catch up, trying to improve the system to make sure everything that's distributed gets administered, with about 20 million people being vaccinated. And below that, I have the numbers for California. So California, I think, is at a 50% rate of vaccinations based on how much they've received so far. So they're improving, and they're trying to get that out to as many people as possible. Because that's led to the logistics complexity. The way it's distributed. I know working within the VA system, it's gone to the Veterans Administration. The Veterans Administration has, besides in vaccinating their employees, has vaccinating those at high risk now, and they've created lists. They've got out to the village of Cabrillo and started to vaccinate homeless out at the village of Cabrillo. So that's a federal institution. So it goes out to the federal, it goes to the territories, it goes to the states, and the states decide how much goes to wherever. And I know California is in the process of trying to redesign how that process all works. And most of the time, most of the things we see now, it's gone to hospitals and to these megapods. I volunteer at the Disney megapod out in Orange County. I was there yesterday. We vaccinated about 3,000 people. And I have to say, besides the number of vaccines, the other key part is having enough healthcare providers that can administer the vaccine. And kudos to the nurses. They're out there from 8 in the morning till 5, giving vaccines all day long. And these are nurses on their day off, so it's an amazing thing to see what happens at some of these megapods. But I'm sure that as vaccines become more plentiful, they'll eventually end up in the pharmacies where people can go to their local community to get vaccinated. But the biggest challenge folks have faced, especially the over age 65, is I got to get online. I got to have a smartphone. I got to figure out how to get an appointment. I got to go stand in the line with hundreds and hundreds of people and try to remain safe and get vaccinated. So it's very challenging. It's very challenging for a lot of elderly folks. And those are the folks that we need to reach out to in all communities to see, well, how can we help that? Can we perhaps, set up different sites in the local communities where folks can get vaccinated to do it? And our other challenge, of course, is hesitancy. So I wanted to just share the challenges I think are vaccine hesitancy. We need to overcome that. These vaccines are safe and effective, and we need to advocate for that. The challenge is vaccine available, and we know, there's limited supply, and that's just the way it is. But we need to make sure that we have to reach all the community, and that includes underserved communities, not only to overcome vaccine hesitancy, but able to have it available to everyone, and not somebody who just is really good with a computer or has their kid that can sign them up online. We need to be able to figure out ways of that. And I think that there's a role for churches and the clergy in this process. How can they work with the city of Long Beach? Can they be vaccine centers? Can they work within their local community to promote vaccinations? So in sum, as in looking at COVID and the pandemic, I think Romans 12:12 is so applicable that we can rejoice in hope, that God gives us that hope. That there is a light at the end of the tunnel. We have hope, and we have hope in God, that we should be patient during this time. And it's hard to have patience, but we obviously need to be patient. We're instructed to be patient and to be constant in prayer, as a verse. And this is Eric, as you mentioned, Dr. Glenn, he's got that verse posted in his office, and he's reminded of that every day. So that is my brief presentation, and Dr. Marsh and I would be open to any questions that you may have for us, and I'll get out of the screen sharing thing.
What a gift. That was a great presentation. I'll do that, and then I'm going to knock you off.
Okay.
If you'd like to send me questions, you can do that either via Gregory. Nice to see you. You can do it either through this chat feature, or you can text me at 562-760-8546. So what we'd like to do right now is Dr. Ford, I'd like to open hand you the mic, and I want to just humanize it. We heard a lot of stats. I really appreciated your comments about how real it is and how what you're seeing at the hospital is, has been really, really difficult. So could you just give us a quick picture within HIPAA law of what it's been like for you just as a doctor at Memorial Hospital, the hospital we all love and have had our kids at?
Okay. In the beginning, maybe like I was hesitant with the whole political arena that we've been in. I was not that confident I didn't believe in the virus. I was also following what the president was saying is like a flu. And I'm one that's kind of skeptical with everything, especially when it comes to getting vaccines, until I was thrown into the fire. And once I started seeing younger people, because you can brush off anything like, oh, it just affects people that have pre-existing diseases, the old, the obese, the people that are, quote, are sick anyway. And I was part of that group. But then I started seeing young people come in. Young people, my very first COVID intubation was a woman, Hispanic lady around in her early 40s. And she died that next day. And the lady was horrified what she had. That opened my eyes. And since that time, I'm seeing all ages. I'm seeing, I'll say black beards, no gray beards, some black beards that don't even know they can breathe. Of course, you see the older population and the people with the coexisting diseases. But the younger people is really what opened my eyes to this whole thing. Because again, I was one of those guys on the fence of, do I get a vaccine or not get a vaccine? I've been vaccinated. And I feel 100%, I'm just 100% glad I did it. It protects my family. I'm looking at the bigger picture of it. It protects those around me. It's something that really, especially in the Black community, there's a lot of skepticism when it comes to vaccination based on history. But I think that the churches really play a major part in this, because most people look at churches where they attend as a safe place, a place where we're going to get the truth, a place where people love you. It's family. And when that family member sits back and says that, okay, I'm doing this. And I think that it would be a good idea that the pastors that should videotape themselves getting vaccinated to help their flock come aboard. Many people have called me in my family and were asking me, what do I think about it? And they, based on what I've told them, and friends, and based on what I told them, they have stepped out, and those that could get the vaccination went out and got it. And those that are still in line waiting can't wait to get it, because they have someone that they trust, that they can speak to, not someone that, is just a talking head, to help them get over those fears.
I'm stunned by your humility. I wasn't expecting you to say that you were a doubter. It takes a measure of courage and a whole dose, and we're using the word dosage, a whole dose of humility to say what you just said, and I want to say thank you for that.
Thank you.
Gregory, I want to throw it over to you. You jumped on it and said, hey, the Ministers Alliance wants to help sponsor this. Speak to the leaders that are watching now and those that will watch the recording, why you said yes to co-sponsoring this and what you're seeing in your communities you're trying to serve.
Well, I think, as my brother just said, it is critical, and I believe ultimately vital, that we all get vaccinated. This virus is not going away anytime soon, and we need to use every precaution we can. But I am hearing the voices of those that are hesitant, those that are nervous. And like my brother just said, they don't trust it. They don't trust the conspiracy theories attached to it. For Black people, we have issues ever since of, Alabama, where they were injecting us with syphilis. And so, there is a little bit of that hesitance. But I do agree that we do have to move forward. I was just on with the health department, and I heard we've done like 39,000 injections in Long Beach, but that's only the first injection. And they're going to try to schedule a second injection for February. And so communication between the first and the second seemed to be a little challenge. But for me, I'm looking forward to getting vaccinated. I believe that it's the right thing to do and the right time to do it. And so I do want to encourage everyone to really be diligent in your prayers concerning the timing. We know we all have to. My question to the health department is, where do the pastors fit in those tiers? Like my brother was just saying, it is important for us to kind of to prepare the way, if you will. We are the John the Baptist of this, the vaccination movement. And so we need to prepare the way, but I'm not 65 yet. And I know the first wave has been for 65 plus. You know, how do we find our space with the teachers, with everyone else? We are first responders. So, you know, how do we do that? And then, you know, I am definitely open, and I believe we should, you know, have a documentation of our experience, and whether that's video, photo, you know, narration, whatever. But I do believe that we do need to move forward as faith-based leaders and really lead the way, prepare the way for other people to have confidence in what is going to be an inevitable requirement. I think one of my questions I wanted to ask the doctor, and then I'm going to leave, I know we're live, is that I don't know, I hadn't seen much in the clinical trial response or data. Did that exist? Or, you know, I mean, normally there's data with the clinical trials, not just with, you know, people who've taken the vaccine.
Yeah, it hasn't all been published, but was submitted to the FDA. And so there are, you know, huge data sources of the clinical trial data available, you know, that I can send off links to folks who would be interested in reading about the clinical trial data.
And demographically, the data, sorry, Eric, the data is demographically kind of profiled. Is there a dashboard that says, you know, X amount of Blacks, X amount of Hispanics, X amount of, you know, Native Americans, or kind of what that looks like as well?
Yeah, I believe they have that too.
Okay, that would be really interesting. Thank you.
Yeah.
And that would help us. That would really assist us.
I'll post that in the Facebook Live link, and we'll also attach it. The doctors are giving us permission to share this video if you guys want to share it with your congregations, which is, I found it incredibly helpful. Couple of questions, and feel free, either doctor, to answer it, that have come in. How are scientists able to develop the vaccine so quickly?
Well, I'm not an immunologist, so that's beyond my pay grade. You know, there's just some very brilliant people out there. I mean, there's just thinkers out there that study this every day, and that mRNA virus, I think, is genius, in my opinion. That was another thing that brought me on board to get this vaccination, because vaccinations in the past have been with attenuated viruses, and some people always felt that they might get a virus that is still too strong and they'll affect them. I mean, it's all kind of stuff you hear out there. But that mRNA, that right there, it allows you to just really change it on the fly. I mean, it's genius. I mean, that's again, it's beyond my pay scale, but it's genius what they can do with it, because you can just manipulate that mRNA in a short amount of time, versus, you know, we had to grow them in eggs before. You don't even have to use that medium anymore. It's just technology. I mean, you know, it's just technology.
Dr. Gray?
Yeah, and it's not brand new. They've had mRNA as they've studied different types of treatments for cancers and other things. So there's a little bit of technology there. I agree. This is a whole new realm of science, and the way they're able to target things with it, I think, is fantastic. And, you know, they've cut through the red tape to be able to move things quicker than they normally would. as before. So the red tape is gone. The other part is it's not just approval process, it's they were manufacturing this as they were doing the studies in the hopes that the studies would show that it's positive. And they studied this in a lot more people than you would normally study a vaccine for. And they did it in the appropriate time frame. So they just kind of, studies go from animal studies to 1A, which is kind of like a dose ranging, to studies where we do double-blind controls in patients. So they had packaged that in a way that they could go through that in a faster pace, but doing it safely.
Okay, another question came in related to the red tape. A lot of the red tape, when we do an addition on our house, sometimes that red tape drives us nuts, right? Some of it is, we understand the reasons. Some of it doesn't make sense. Can you explain why there was red tape and the pros and cons for kind of going around or over or cutting the red tape?
Dr. Gray?
Okay, red tape regarding
the development of the vaccine.
Development of the vaccine?
Yeah.
Well, just the normal process where there's, I guess, so normally when you develop a new drug, it's a very long process that you follow, to get a full FDA approval. And it's not, and so they were able to get through that just at the faster spot, just by getting rid of whatever barriers may have been there to move the trials. So it goes through the same
trials
and the same intervals. They were just closer together. Okay.
I asked my brother that question I said, so tell me how with the HIV, it took forever to develop a vaccine for that. And my brother's a biochemist working for a company down in La Jolla. He said, Eric, he goes, how big was your phone in 1980? He said, I think our understanding of science when it comes to DNA has significantly increased since 1980. So excellent. Another question. Why, Gregory, you talked a little bit about the fear of the vaccine. Dr. Gray, you first. Why do you think we have a large part of our population who's afraid of the vaccine?
You're hearing different stories from different leaders. Some saying that, it's just a bad case of the flu. Some saying that, do we really trust the government? Do we trust the scientists? And I think from my perspective, there's just a lot of misinformation out there on social media. And that led to some treatments that were tried that weren't effective. Okay, so you have those barriers out there too. Just some thoughts.
That's good. Dr. Ford, do you have anything you want to add to that?
But again, just to piggyback on what Dr. Gray was saying, yes, there's a lot of mistrust in the government, two sides saying one thing or the other. Not a central person saying just one thing to the masses. And also, again, in the Black population, Tuskegee, whatever the experiments down through history, that's been in Black people's DNA ever since I was aware, 12 years old. So there's a mistrust that's just innate in brown and Black people against the government really not looking out for your best interests. You can look at it from, not even just from a medical standpoint of view, but from a law enforcement standpoint of view. There's just so many things that come into play. And again, I'm guilty of it also. It's what I was brought up on. And it took, again, like I mentioned earlier, I was a doubter, and it took me to actually physically see what was going on to take that leap. Because to be honest with you, if I had not had that exposure, I would still be sitting back going like, okay, we're going to go with the herd, but I'm not going to be part of the herd. And that's just being honest. Because again, from what I've learned, although I'm a scientist, but I'm still human. And so I was a human first before I was a scientist. And those beliefs that I've been taught for all those years were hard to break. And that's one of the things that just say with the clergy being involved, you have to have someone that that people look for, that people admire or look up to sit back and just say, hey, it's okay. It's okay to have this done. You know, what you believed in the past, let's let that go. That, you know, it's okay. And that's, I think, one of the biggest problems. And that's some of the conversations that I've heard from family members. I'm still not going to get it. You know, Bill Gates is injecting you with whatever, whatever. So you hear so many crazy stories, but you have to respect those stories, because I do understand where they're coming from. And I never try to talk anyone into taking the vaccine. I just give them the facts and let them come to their own conclusion. Because until you have someone that's in your family that gets unfortunately affected with this, and you may lose them, that's the only way you're going to come around. You know, I have a friend, you know, I have some colleagues. One colleague contracted COVID early on, and he was a non-believer. Matter of fact, he was a Republican, and he was a staunch Republican. And you know, he would say he was like trying to breathe underwater. And he called me up. He goes, "This is no joke." He's from Texas. He goes, "This is no joke." And then I have another friend that, well, it's nothing. I just had the sniffles. So again, this whole thing, you know, you have people in the same family where some will get the sniffles and some will end up in the mortuary. So it's this is a being or animal that we don't know what is going on, and there's no answers to it. And it's a fluid situation. That's tomorrow we're going to hear something else. It's not that the information is wrong, it's that we're just adapting to what we have on board. And that's what people have to understand. But it's better to get the vaccine to and become part of the herd. We have to do something. We have to do something. Those numbers are not lying. You know, in my hospital, our recovery room is 75% an ICU. You know, we had 25 recovery room beds. We only have 10 for surgery. If you come in for surgery, you only have 10 that are there for your surgery. Everything else is an ICU. And if you go up on the wards, the pediatric wards are now an adult ICU. We're out of beds, and they're still coming in. And until you're on the front line and you actually see what is going on, that's the only way. You know, if someone could spend a day with me just to take a tour and see what I see, it would change your mind.
Awesome. Great. I think I really appreciate Dr. Ford and Gregory, you bringing the perspective, the historical perspective of African Americans. I think those of us in the largely white church have a lot of history to learn as to why the hesitancies. That being said, it's interesting. Dr. Gray and I were talking earlier about how it seems like conspiracy has become a new side profession for white evangelicals of late. Dr. Gray, with that in mind, how would you encourage pastors to address, particularly in the white church primarily, address with honor those who are skeptical of the vaccine?
I think I would offer encouragement. You know, everybody has a choice, but I would encourage those to think about your brothers and sisters, because the opportunity to transmit the virus is still there, and really until you get vaccinated. So autonomy is not just yourself. Autonomy, you need to think of the people around you in your society. And so I would encourage them to share that, you know, that this may protect your mom, your dad, your grandmother.
That's good. We got a question that came in regarding how we think about the vaccine and regathering indoors. You know, a lot of our congregations are really looking forward to being back indoors. How should we be thinking about the timeline for being back indoors, and how do each of you think about how the vaccine might contribute and help accelerate the chances that we might be back indoors?
I think that I don't know the timeline. I don't want to put one on it. I would just say a year at least. I know we all miss, the social interactions that we once had, but if we want to get back to that, I think the quickest way is to everyone, let's get this vaccine. I was hoping that the Super Bowl would invite all those that were vaccinated to the Super Bowl, and I thought that would be like but they're only doing people in Florida. But I thought that would be like on a different medium. To show people that, hey, look, if you get vaccinated, look what we can do again. And I was hoping that, I was going to go Super Bowl. But anyway, I was hoping that was going to happen. But I think that, once we get vaccinated and we slowly come back together and we start to see these numbers come down, because we got to see these numbers come down. We have to see these ICU numbers come down to show that this, what we're doing is working. And that, I think that's going to take time. And I think once you have that data under your belt, we can start saying, okay, we can gather again. But we just need the evidence to prove it.
That's good. Dr. Gray?
Yeah, I agree that we watch the numbers, we need to see them come down. And that when 70% of our community is vaccinated, we're going to have a herd immunity. So it depends on how fast the vaccination process takes. And like Dr. Ford said, to follow the numbers.
That's great. That's great.
Eric, can I ask a quick question?
Of course.
Do we have a second? One question, maybe the doctors can help me out. Right now, I believe in Long Beach, to get vaccinated, you have to give your mother's last name, your date of birth. I mean, it's almost like a loan application. Is that actually the case? I just wanted to ask that.
Well, for me, it was easy. I mean, we didn't have any of that. They just took my information because, they want to follow you. I didn't have any of that. And so I'm not out on the front lines like Dr. Gray is, where he does Disneyland and things like that. That's a better question. Maybe, he can give you better information on that.
I can't speak for Long Beach because I haven't seen what information they're requesting, and you may be correct in requesting that. I know that they want to show that you either, for those who are eligible, you either live in Long Beach or you work in Long Beach and can show evidence for that. But I don't know if they need the other information. I know that in Orange County, they don't need any of that other information. They just want to know, yeah, you're over 65 or you're a healthcare worker and you live in Orange County.
Yeah.
That's great. Thank you, Gregory. We want to respect everybody's time. I want to, before we're gonna challenge you with one more thing, but I want to say thank you, Dr. Ford and Dr. Gray, for taking the time on this day to. It's such a gift to have the two of you on and giving your time to the leaders. We've got a whole bunch of leaders who are watching this and will be watching it later. I wanted to give each of you a chance to just, if you could speak directly to the leaders, the pastors, the elders, the Christian nonprofit leaders. What is the challenge you'd like to leave them with? We'll start with Dr. Ford.
I think the challenge again is getting people to trust, to understand, because once you have that trust, people are more accepting to what you're trying to put forth. It's just like when you say walk by faith, not by sight. When you have someone that can believe in that phrase, it's the same with this. I think that the clergy should really get vaccinated on video, tell what they feel, encourage those that are on the fence to step up, encourage those that this is the bigger picture. It's not about you. It's about all of us, because this is about everyone in the United States. And that if we all step together, as Americans, as a family, we can beat this. But it's going to take everyone together to do this, not just some, but everybody, even the gangbanger on the corner. It's going to take everybody to get vaccinated and move forward, and let's beat this thing, because we don't know. This is a different animal, and people are trying to use knowledge from way back to address this issue. This is entirely, this is his own animal, and it has its own set of rules. and we're learning on the fly. And I think that's why there's so much skepticism among people that are on the fence, that because there's questions that keep coming back. Well, what about this? What about that? Again, we're learning on the fly. And I think that people need to understand that this is a different beast. Mm-hmm. And this beast, as you know, as Dr. Gray's slides were showing earlier, with influenza, 22,000. And with this one, 420,000. This is not the flu. This is another animal. And as soon as we understand that, accept that, and step up to the plate and get vaccinated, because that's our only defense that we have right now. And then we should all just get together and do it.
Go to the Super Bowl next year, right? We'll have the Super Bowl. Dr. Gray, last comments, challenge us.
Yeah, I just concur. I think you pastors, the leaders, you're the trusted leaders. People are going to listen to you. And if you can be advocates for vaccination, that would be a wonderful thing for that population, your family, your church family members. And I would also ask for you to consider, if there's an opportunity to work with Long Beach or whatever city you're in, to where you could hold a vaccine clinic at some time, to where you get vaccinated and where folks from your community can get vaccinated. That would be great. Just reach out to the city of Long Beach, and I bet if enough church leaders did that, that could happen.
And one more thing, and that's, just to piggyback on that, I don't know if there's enough manpower for that, but it would be nice if it could be done at the church. Because yes, you're in a familiar environment, what you consider a safe environment. And if it can be done there, if we had the manpower, again, I don't know the logistics behind that, but that would be a great thing, because everybody can't drive to Disneyland.
There you go. Well, I'm hearing you say, Dr. Ford, that we're going to have Wayne Chaney get a shot from Maisha, since she's a nurse. We'll have that next Sunday. I'll make sure that it's on. We get it on TV, and we'll all be excited about that.
Yeah.
Dr. Ford, Dr. Gray, and Gregory Sanders, thank you for your work, Gregory, in the city. Dr. Gray, thank you for your presentation. It was first rate. It was very clear. It was applicable, and it was really, really helpful. And Dr. Ford, thank you for your expertise and for your willingness to serve in Long Beach Memorial. We're really grateful for you.
My pleasure.
Thank you.
Again, my name is Eric Marsh. I am the director of the Long Beach Church Collective. We are so grateful for this chance to share some information. If you want, reach out to me via email, and I can send you the link to this recording after we get it edited. All right. Have a great night.
All right. Thank you.
Thank you. Thank you. Thank you, Eric.
Thank you, doctors. Really informative. Thank you so much. Thank you, Eric.
It's good. It was good. Thank you, Dr. Gray. Good job.